So we fed all of our pathways into a language model using Gemini and Vertex AI, and we built an interactive communication path. So now as a doc, you can say, I have a patient, 5 years old, has fever, cough, vomiting, all the symptoms presenting to the clinic or to the emergency room. What should I do? And what the Agentic AI will do is will troll through all of that knowledge it has, and it's all validated by our clinicians. So it's not going out to the web or anything. It's only using our validated pathways, and it's saying, hey, thanks for telling me that. This is what you should do next. Go and run this test. Go and do this X-ray or scan or whatever, and then come back and tell me what the results are. Then the physician comes back and tells the agent, the agent the results. The agent then goes through the pathways again and says, well, we think here is a differential of what this could potentially be. Now, this is what you need to go and do next, or you need to prescribe this medication. So tell me what the weight of the patient is. So put the weight of the patient in, and then it will say, based on this patient's weight, this is the correct dose of this medication that you should start the patient on. These are the things you should monitor. And you keep interacting with the agent, feeding in the information, and it keeps telling you the next steps. Now, if you're a doctor in training, over a period of time, you're actually just going to learn this, right? Very quick way of learning without reading thousands of pages. If you're a seasoned professional, it allows you to validate what you may already know, but you may have forgotten the dosage, right? Because so many drugs to remember. But this way you make less errors and you are building your practice on standardized pathways that hundreds of clinicians have built over the years. So we've launched that tool. We call it Pathway Assistant. It took us 50 docs, all of which donated about 100 hours each to help build this product. Google helped us on the engineering side to build it, but it was our data, which we already had. What was really interesting about it was it also helped us identify errors in our pathways that we didn't notice because there were typographical errors and other things, and it highlighted there were errors, and then we were able to correct those.